A Port Colborne mom has been struggling to get her special needs daughter pediatric care ever since she turned 18. She's part of a bigger group of parents who say they're frustrated with the healthcare system. They believe kids with complex health conditions fall through the cracks. Vanessa Danabalin has that story.
That's my biggest fear, is that because she's here and she's so complex that something drastic is going to happen and they're not going to be equipped to look after her.
Tammy Embrey's daughter, Kiesha, is currently admitted at Juravinski Hospital. She says her daughter is 18, but physically looks like she's 6 years old. Kiesha has a number of disabilities, so she needs complex care. Up until April, she was getting pediatric care from McMaster Children's Hospital. But when she turned 18, she technically aged out. Embrey said they could no longer treat her.
With MAC's policy, they have it that when kids turn 18, they are discharged out of the system.
Since then, Kiesha was taken to other hospitals, but hasn't been able to get proper treatment anywhere.
She wasn't able to be looked after by the peds doctors because of her age, so she had to be seen by the adult doctors. But then we seen 3 doctors there, and because of her size and her complexity, they said that they weren't able to look after her well enough.
Embrey filled out special request forms to get McMaster Children's Hospital to keep her for a few extra years, but she hasn't heard back. She says a number of doctors who've treated Kiesha also wrote a letter to the hospital about her needs. CHCH News reached out to Hamilton Health Sciences this afternoon, and they tell us they are unable to share information on this case due to privacy concerns.
Embrey says she's not upset with the doctors or the hospital because she says they've been doing their best to help her daughter, and she understands that their hands are tied. But she's just frustrated and worried that her daughter might not receive the care she needs.
The adult world is not equipped for our special needs kids. The medication, they do a standard adult dose, where with my daughter, giving her those adult doses, if not checked correctly, can overdose her.
And she's not alone. Shauna Cassidy has a son with cerebral palsy, who's also over 18.
I've been in healthcare for 20 plus years, and I really feel like a lot of our kids are slipping through the cracks. If my son was to be admitted to hospital at this point, he'd be sent there and I wouldn't be able to stay. I take care of all his daily needs for him.
They say the healthcare system needs to be improved to provide more support for special needs kids who become adult patients.
We reached out to the Ministry of Health, but they did not provide a statement or comment. Instead, in a response, they said hospitals are independent corporations responsible for their own operations and services. We asked Hamilton Health Sciences about its policy on children who become adult patients, but have yet to hear back.